guys, this is Nay here. You're going to be coming along with me on my med-surg trauma unit nursing clinical day, okay? I have evening clinicals, which is basically from 2 to 11 p.m. at night. Right now, it's about 11:30 going on 12. I'm about to go grab some lunch with my husband. I like to eat a heavy lunch before I have these evening clinicals. That way, it kind of carries me through because the next time I'll be able to eat for our break for clinical is at 6 p.m., which is like dinner time, you know. So yeah, I'm gonna show you guys right now what I have in my little nursing bag and what I have for lunch. Okay, so this is my nursing bag. It is not cute at all. It's very tattered and old, but it gets the job done, and it's a book sack. Put it on my back. But I'm gonna show you some things that I have in here. The essentials, my little stethoscope right there. It's a cute pink one. I have my supplies like bandage scissors. You can get these from anywhere. And then I also have like a watch. You know, you need that. That's important with the face on it. And then other stuff, you know, I have pins, any type of feminine items, stuff like that, snacks, right? And then this is my clinical top. Our clinical tops are white, so I put it on like right when I'm walking to the hospital to avoid trying to get it dirty. So that's why I have it in my bag. Oh, and then of course, other stuff I have this deodorant right here. Spray this on, that way I'm staying smelling fresh. And then I have like different, this right here is like a nursing report sheet. So like you can put like different stuff about your patient on there. It's like a report sheet. Different things, their labs, kind of quick stuff that you can look at. And then like their meds. And it just helps me to stay organized with my patients or whatever that I have that day. So it's not super cute or anything. I've seen they have some really cute ones, but it's basically like a little book sack and it gets the job done. Next we have, this is my lunch bag. Has a bunch of compartments in there, and I'm gonna show you kind of what I got for lunch tonight, for dinner. Well, for dinner, because I have evening clinicals. I always take water with me. I put my name on this and I leave it at the nurse's station to hide, so that when I'm coming from a patient room or anything, I can just kind of grab a sip of water from there. Then for lunch, I kind of do my freezer meals. So this is my freezer meal. I cooked this Sunday and, you know, froze it. And it is black-eyed peas with chicken breast and gravy and rice. So something nice and heavy and filling. And then for my snack here, I have some grapes. These are really good. And then of course I have other options of snacks that I can eat. Like this is a protein bar right here. And then I have like little candies and stuff if I need. And then I like hot tea. So like when we go on our dinner break at 6, I like to drink teas. So like I have a mint tea, and then I have a green tea. And I basically make my hot tea like I make coffee. I'll put Splenda in it, I'll put creamer, and I just use one of the cups at the hospital. Alright guys, I just left brunch with my husband and I came straight to the hospital. It is now about 1:20. I have to be on the unit for 2:30, so I'm probably going to leave my car and start walking over there about 1:45, 2 o'clock. I don't want to get on the unit too early, but something I wanted to show you is, you know, another thing that's pretty cool and convenient is like these badge holders. So I have my badge covered so that you don't see all of my information on there, but you know, having a badge holder like this, you can put your badge in the front, and then on the back of it, it's like a little wallet feature, so it can have like your you know, your wallet and like your credit card information. And then I also, you can put like tape sticky notes back here for like passwords, and you know, if you have to use codes and stuff like that, I put those on there as well. Yeah, so let's head to the hospital. And then here you have lockers. No TV. Hey, hello. So right now it's about 5:40, and we're kind of wrapping up. It's been pretty busy today, but it's been good. I'm really excited to share with y'all all the good stuff and cool stuff I got to do today. But it's about 5:40, and we're going to lunch. We're going to lunch at 6 p.m. So we have about 15 minutes to wrap up stuff, help each other with anything before we go to lunch. So yes, I'm excited to take my little break. Okay, so it is 8:30. I've already done my med pass. My nose is itching. My med pass. So, and you know, help my patient and stuff get situated for bedtime, going to sleep. So the unit is pretty chill. It's pretty cool. All the students have, for the most part, done all of their work. So now we're just kind of waiting around, doing any last minute things that we need to do, helping each other out with anything before it is time to, you know, wrap stuff up around 10:30. So we still have like 2 hours left. So yeah. So this is the cleaning room, and also all the supplies. Some stuff in the refrigerator, nothing. Freezer, like popsicles. So yeah, today was a great day, and I got to do a wound, change the dressing and stuff on the wound and clean that up, which was cool to see, because you get to see just the different damage that a body can take through a wound, whether it's caused through an accident or through some type of infection or disease process. You know, you get to learn a lot through a wound, especially cleaning it and kind of seeing what's under all those dressings. So I got to do that today, which was pretty cool. Just kind of a little bit about the patient I took care of today. The patient had a broken bone. I'm not gonna tell you what specifics, but a broken bone, and it became infected. So osteomyelitis is a bone infection, and that's basically what the patient had. And they were treating it with some different antibiotics. If you're interested in some of the meds, the antibiotics, it was Rocephin, vancomycin, and cefepime. So those are some of the heavy hitting antibiotics that they gave to treat this wound infection. It can be different for each patient, but that's what this patient had. Yeah. So yeah, those are some interesting things. You know, they have some normal medication, for diabetes, insulin, and then also, some antidepressants and things like that. Those type of meds, also antidepressants on here as well. But other than, it was, great patient, great day. I learned a lot. Like I said, I got to do a wound dressing change, which was really fun to do. We basically unwrapped the area that was infected with the broken bone that was affected, and got to clean it out, see the stitches and what it looked like, what type of drainage was draining from it, and clean it up really well, and then rewrap it back up. So that was just a good experience, you know. There are so many different types of wounds and different things like that that you're going to clean as a nurse. So as much wound care experiences that you can get is going to be really beneficial for your career, because that wound care experience that you gain from the hospital, you can take that with you if you want to be a home health nurse. You can take that with you if you're working in a nursing home. You can take that with you, honestly, if you're taking care of a family member. You know, like, there's so much to gain from like being comfortable with cleaning wounds and like knowledgeable about it. So whenever I see a wound and I can clean it, you know, it's pretty cool. But anyway, the plan of care today was, you know, they prescribed the patient some nerve medication to treat the pain for the broken bone, and manage the patient's diabetes, and manage their pain levels. So they also had a PICC line too. So I got to see the nurse administer a bunch of all those antibiotics through their PICC line, because the peripheral IVs were like blowing. They weren't staying. So yeah. So I mean, it was just cool to see all the different things that the disease process play out in the patient, and how the stuff that we're learning in class, you're seeing it on the clinical floor, and the different like interventions, nursing interventions and stuff that you're learning in class, you're actually applying them and using them on the floor. So that's always cool to see. It was a great day. I'm tired. I'm pretty sure all of my family is sleeping. I'm sitting outside in my car, so I'm about to go inside and take a shower and maybe kind of relax a little bit and watch a little maybe watch one Netflix show, because I need to unwind. Either watching a Netflix show or listening to some music. It helps me unwind when I come from clinical, especially at night. Like it's 11 o'clock at night, so I have to kind of unwind from being awake and taking care of patients and walking up and down the hospital halls and stuff like that. So either listening to some relaxing music, watching a Netflix show, or taking a bath, drinking a glass of wine, that helps me to kind of tune down from working a hospital shift. So that's what I'm gonna do. So I hope you guys enjoyed this vlog. I don't know, this vlog it was pretty short, but I hope you enjoyed it and you got some good stuff out of it. Drop me some comments below, like and subscribe, and yeah, see you in the next video. Peace.